Hi everyone, this is Dr. Priyanka, a prosthetist and orthotist from revivelifehealthcare. Today I'll be speaking about an ankle foot orthosis, AFO, and this is specifically an articulated kind of AFO. So first we will talk about the basic indications of ankle foot orthosis, like in what condition we can recommend an AFO to the patient. First, it can be most common foot drop. It can be mediolateral ankle instabilities. It can be knee instabilities, or it can be any kind of muscular weakness in the foot and ankle joint. So today I'll be speaking about a patient-specific case. So I'll not disclose the patient name, but I'll just tell you the patient's condition. Our patient, she is 40 years of female, and she has a pes plano valgus deformity in her feet. Pes means foot, plano, valgus means that her foot is going inside, like it is going outside with the arch drop. So we have recommended her an articulated AFO with a rubber sole because she is in a spiritual thing and she can't wear sandals and shoes often. So she wants something which she can wear without shoes and sandals. So we have given her the rubber sole to avoid the skidding. So this is an anti-skid rubber sole. So this AFO, it looks like this. It has two basic components. One is the foot shell and other is the calf shell. And both the shells are joined with an artificial ankle joint. We call it as a tamarack ankle joint, which mimics the normal and anatomical foot function. Like it's in the flexion and extension, plantar flexion and the dorsal flexion of the foot. So this will help in patient's ankle movement, and as well as it will address the pes plano valgus deformity of the foot. As you can see, we have provided a high medial arch. So we have provided an arch to support the medial longitudinal arch, and we have provided the high medial flinch to prevent the foot from going outward. So this will also help in addressing the flat foot of the patient as well as the valgus deformity of the foot and ankle joint, and it will allow the ankle movement, which will not restrict the patient basic activities of daily living. And on the other side, we have given the patient footwear which she can wear while moving around outside the house. So this slipper also has a medial arch to provide support at the medial longitudinal arch, and both the devices, these has same height to avoid the LLD of the patient. So this will help the patient in maintaining the. So we have basically 3 staff incorporated in this articulated AFO, as you can see. First, to support the forefoot of the patient. Second, to support the ankle area of the patient, which has inner padding to avoid any kind of rubbing with the skin. And third, we have given it the calf area. So it will go like this, and it will support the whole foot and ankle of the patient. And she can roam around inside her house or her spiritual place without any fear of falling, because we have given the anti-skid rubber sole. So if you have any friend or family or any fellow person who is suffering from these kind of issues, foot drop, muscle weakness, ankle instability, knee instability, etc., then you can recommend them to revivelifehealthcare. We provide the best and the effective solution to the patient. So you can reach out to us. It's revivelifehealthcare, and this is Dr. Priyanka, prosthetist and orthotist.